So I was not planning on making this video today, nor was I planning on filming it here in my room. So as you know, in my last two videos, I talked about my treatment plan coming up. Last week I made a video about starting radiation, which I was supposed to have Monday, Wednesday, Friday, and today is October 21st, and I'm supposed to be getting the cryoablation. So today I'm going to tell you guys about what happened. Last week, I went in and got my radiation as usual on Monday and Wednesday, and then Friday, I was supposed to get my last dose of radiation. However, on Thursday, my radiation oncologist called me, and she actually called me a few times. I just missed her call. I finally picked up on Thursday, and she said, "Hey, so I've been able to follow the last two treatments that you had. And usually when they give you treatments, they do a CT scan to make sure that everything is in the right place before they give you the radiation dose." So she commented that when she looked at the CT scan, she noticed that the soft tissue component of the T2, T3 lesion seemed much smaller. And so I asked her, what does that mean? How much smaller? And she said she could barely see it. It looked like there might have been a sack of what's left of it, but she's not sure because this is not the type of scan that is the most accurate. But it was enough that she felt like she needed to cancel the treatment. She said that she saw I had MRI scans coming up for my clinical trial. On last Friday, I had it scheduled for the MRI brain, MRI of the C-spine, along with the CT chest, abdomen, and pelvis, which were pretty much routine scans for the 3 months that I usually get, but it also was done for the clinical trial. And so she said, since you're getting the MRI, then we might as well just see what the results of that are, and they can just expand it to include the T2, T3 level so that I can see if it's really there or not, and I can adjust the radiation dosing based off of that, or we might just cancel the last dose of radiation altogether, which is what she thought was going to happen. So in my mind, I'm already thinking, whoa, this is crazy, because I have been feeling a lot less pain, and I told you guys in my last video that I have had zero pain when I've been having so much pain for months and months and months. So I knew that something was happening. It just really wasn't reflecting on the scan results, because I got scans done just a month ago in order to plan the radiation and in order to plan the cryoablation, and it showed significant growth compared to the scans that I had back in July. So in my mind, symptoms didn't really correlate with the scan results per se, because my pain was already lessening. So I didn't really know what was happening, but since she said that, I just knew that the cancer was going away. I just needed to confirm it with the scan results. So I went and got the scans done on Friday as planned. And then today I was supposed to go in for the cryoablation that they were supposed to do for the 3 ribs, the one on the left side, the 7th rib, and then the 10th and the 12th rib on the right side. The procedure was at 12:30. I had everything planned. My mom came to help, and my sister was supposed to pick me up when I was done with the procedure and everything. I had it all planned out. And then I went into the pre-op, and as I was waiting there, the doctor came in, and I told him what happened. I said, hey, my radiation oncologist actually canceled my last radiation dose because she thought that the tumor looked smaller. And I got scans done on Friday, which they haven't read yet, but I was wondering if maybe you can take a look at it and see what's going on with the ribs, because I really haven't had much pain. So he looked at it with me, and right away he saw the right 3rd rib. He said that looks a lot smaller. He measured it out. It looked like it was at least 1 centimeter smaller than previous, and this was a month apart. And then he looked at some of the other rib tumors, and he said that those looked smaller as well. But this was the fellow, so he wasn't the actual interventional radiologist that was doing my procedure. He was just kind of the doctor in training. So he said, okay, I'm going to go get the doctor that was going to be doing the procedure, and I'm going to ask him what he wants to do. So he left, and like 15 minutes passed by, and then the doctor that was doing the procedure came in to see me. He said, hey, I looked at your scans, and it looks like all of the tumors that I was about to treat have shrunk significantly, and I don't think that we should do the procedure. So I'm just like staring at him, and I'm in disbelief because I'm so excited, but at the same time, I was so happy, you know. It was like I knew that it was improving, and I knew it. Inside, I just had this gut feeling that the scans were going to be good, but I just didn't know how good. And I even thought about getting the cryoablation. I even thought about whether or not I should go forward with it. And there was just not enough time in between for me to just call him and be like, hey, can you look at the scans and check and see if I should even come in? But basically, he said that because they're all improving, and it's like an overall significant improvement of all of the lesions that they're following, he just doesn't feel like it's necessary to take the risk of doing this procedure that's going to increase my risk of bleeding and infection. And he said potentially I might get numbness in the area because it is going to go through a nerve. And he feels like he's just going to make me worse than what I am. And he said we can always go back and do it in the case that I need it in the future. But as of right now, he didn't recommend it. So he discharged me, and I went home. So basically for today, I'm free, and then I took off the rest of the week off of work. This is the last week that I have off before I start my new job. And instead of laying in bed and recovering and thinking about the pain that I might be in and the complications, I end up getting to go home, and nothing is done to me. And yes, so I'm just so grateful and so happy. I just don't even know what to do. And now, while I've been filming this, I've been interrupted twice already. So my radiation oncologist calls me, and of course, we just got back the MRI results, and I finally got the final read of the CT chest, abdomen, pelvis, and everything was confirmed. I can read you the results of the scan. So here it says there are 5 thoracic wall masses present. Each have decreased in size compared to the previous study dated September 12, 2024. So the first one is 3.1 by 2.9 by 2.4 centimeters in the right third rib versus 4.2 centimeters by 3.7 by 3.4 previously. So that's pretty good. And the second one was 2.5 by 1.8 by 1.2 versus 4.4 3.2 by 2.4 previously. The right subpectoral one is 1.8 by 1.2 versus 2.2 by 1.7 centimeters previously. And then the right 12th rib is 0.8 by 0.6 centimeters versus 1.3 by 1.3 previously. And the last one is 1.9 by 1.5 in the left 7th rib versus 2.3 by 1.2 centimeters previously. And the MRI showed nothing new in the brain or the spine. There was absolutely nothing new. And then the lung tumors are all the same in size as well. So this is just amazing. I'm just so shocked, and I'm so happy. I'm just floored by this result, which I was not expecting at all, and especially so soon, because usually it'll be like 3 to 6 months before I start getting results after I become really focused. But this is just at speed lightning, and I've never had results this quickly and this drastically, especially with nothing new, because usually I'll get some good news, but then I'll also get some bad news, like the last time when my C2 area was shrinking, but then my skull metastasis grew, and then I ended up getting a craniotomy. So I'm just so happy, and I just praise God for healing me, for giving me this opportunity. And the verse that just popped up in my head as soon as all of this was happening is in Matthew 6:33, where it says, "But seek first his kingdom and his righteousness, and all these things will be given to you as well." So what are all these things? I feel like I had a complete mind shift when I decided that I was going to go all in on God. And I talked about this 2 weeks ago in that video that I made, where I said that I was going to just go all in on God, and I was going to commit myself to reading his word daily, spending time with him in prayer, doing devotionals. And that's what I've been doing. I've been faithful in doing all of that. And I feel like in the past, I really wavered a lot, and I have gone left and right. And it's just trying to get on that straight path was really difficult for me, because in the past, I used to use a lot of different techniques to try to help myself heal. And I don't think that I had true faith, even though I really, really wanted to believe. I just feel like there was always a part of me that was guarded and hesitant, and there was always a doubt, an underlying doubt there. And I didn't want to doubt. I really wanted to fully believe and have faith that God was going to do what he was going to do. But finally, I feel like that's what happened in the last few weeks for me. Just being in the Word and to really devote myself and to take the time to do it, even if I didn't feel like doing it. I made myself do it. And I just cannot tell you how powerful it's been and how much he has been speaking to me through his words. How many miracles I've seen, how many coincidences, and the things that he has put in my heart and changed in me. I can't even begin to explain it to you. And that's why I've been in so much peace, and I feel like I really just don't have any worries. As soon as I start worrying, I just think about it, and I'm like, why am I worried when it's all surrendered to God's will, and he's going to do what he says he's going to do? I just have to align myself with him. I just have to align my will with his will. And now I finally understand what that means. Now I finally have full faith, without any doubt, without any hesitancy. And I know that no matter what happens, I'm going to be okay. And I wasn't even expecting this at all. I wasn't expecting for him to give me these results. I was okay no matter what. I was okay to go through suffering and to go through treatment and to do whatever I needed to do in order to survive as long as I can for my children, in order to serve the purpose that God put me here for. And so this is just something that came, and it was just so unexpected that it feels like such a gift. It feels like the grace and the mercy that he has. And that's why it reminds me of Matthew 6:33, because I had changed my focus. Instead of doing all of these other things first and then putting God last and saying, okay, I have too many things to do in my day and I'm busy and I have to try to heal from cancer first. And then if I have time, then I'll make time for God. But now I've really flipped it upside down, where I put God first and I put my faith in him. I wake up, I ask him what I should do for my day. I look to him first in everything. And it seems like he's showing me that everything else will follow. So all of the blessings that I have received is as a result of what he can do. He is showing me how powerful he is, how sovereign he is, and just nothing can compare to that. I'm just so grateful. I feel like I have my life back. I feel like there's hope for tomorrow, and I don't have to be suffering. I don't have to be in pain. There may be a way. So now I'm planned for this clinical trial to begin very soon. They actually just called me to schedule me to get a port. And I'm already getting an echocardiogram this week. I got my scans. So the last thing that I really need to do is to get this port placed. I have never had a port before. So I was really hesitant because one of the medications is given every 3 weeks and it's a chemotherapy. I've never had chemotherapy, even though this drug is not the same as your traditional chemotherapy where I would lose my hair, and they said that it's much more mild than that. But it does have to be infused every 3 weeks, and it's infused over 24 hours. So I have to carry home the pump with me to connect to the port. And that's why I have to get a port. So it just kind of made me uncomfortable because I've never really taken such a toxic medication before. But after I researched about it, it seems like there were properties that would probably be synergistic with the rest of the drugs in the clinical trial. So that's why I felt like it was the right thing to do. But now, given this whole situation with my unexpected scan results, I really don't know if I should go ahead with the clinical trial or not. I guess I'll talk to my clinical trial doctors and see what they think, because the rib tumor that they're going to inject has gotten significantly smaller as well. So I really don't know, and I'm just torn right now. And I guess God is going to show me what I'm supposed to do. But as of right now, I just have everything scheduled just in case. And next week I will be starting my new job as planned. But for now, yeah, I guess I will keep you guys updated on what's going to happen, whether I'm going to go ahead with the clinical trial or not, and I'll make a video about that separately. But today is just the best day ever. It's like the best day. And I really just wanted to share this good news with you guys. So thank you all for tuning in, for watching my videos, for commenting. I read every single comment, and it means so much to me with your love and your support. And I just feel so blessed to have you all in this wonderful community. So I will see you in the next video. Okay? Bye.